Hello, my name is Tamara. I'm a student nursing and I'm gonna do head-to-toe assessment today. Can I know your name, please?
Kaylin.
And why you're here today?
Just a checkup.
And what's the president today?
Trump.
Okay, patient alert and oriented times 3. Next, we're gonna check for cognition and memory. So I'm gonna tell the patient 3 words and later on I'm gonna ask her. The 3 words gonna be apple, sky, candle. Okay. Next, I'm gonna check for her mood. The patient is relaxed, appropriate for the weather, dressed. Her mood is good, well. So next, I'm gonna check for general assessment. So the patient posture is relaxed. She's sitting. Her mobility, gait, and everything is look normal. No involuntary movements I noticed, and also I'm gonna look on later during the exam. And she didn't use any devices as she walked in our clinic. So I'm gonna check for pain level. Do you have any pain right now?
No.
0 it means no pain, and 10 is the worst pain. So do you have like 0 to 10? Which one?
0.
0. Okay, if patient says she has a pain, so I'm gonna use old cards. Old cards mean onset, location, duration, treatment, any aggravating, any elevating factors, any signs and symptoms, and if she used any treatments. Next, what I'm gonna do, I'm gonna check her scalp and hair for any abnormalities. I'm gonna check for texture, for any lesions, for bumps. Yep, so just lower your head for me, please. I didn't see any lesions, any bumps, any needs. Her hair look normal with any abnormalities, and the hair texture looks normal. I'm gonna inspect facial features. So her nose is midline, her eyes and ears midline, her mouth is midline. Can you open for me your mouth, please? Everything, her tongue is midline, everything look normal without any abnormalities. Next week, I'm gonna check her eyes for any redness, exudation, or ptosis. I didn't see any exudation, any ptosis. Her lids are normal. No yellowish, the slur look clear, moist, and pink. Okay, next I'm gonna check for perla. So I'm gonna use again my pen light and just look at this light. Follow the light, please. Okay. So her pupils are equal, round, and reactive to light and accommodate well. Next, I'm gonna check for cranial nerves 3, 4, and 6. I'm gonna use my pen light again for 6 cardinal fields. Just follow my lights, please. 1, 2, 3, 4, 5, 6. Okay, her cranial nerves 3, 4, and 6 are intact. Next, I'm gonna check her cranial nerve number 2. It's optic nerve, so I'm gonna show you a Snellen vision chart. You're gonna tell me the letters. Cover one eye at a time.
P O E C F O T.
Okay, good. Her vision is 20/20. Patient's supposed to stay 20 feet away from the Snellen chart. And I'm gonna tell also cover another eye and uncover both. The patient cranial nerve number 2 are intact. Next, I'm gonna check cranial nerve number 7. It's a I'm gonna show you and give you like to taste something in the tongue. It's gonna be sweet or salty. You're gonna say for me, okay? Close your eyes. Yes. Open. So it's salt. salt or sugary salt. Next.
Sugar.
Okay, so raise your eyebrows. You can open your eyes. Okay, puff your cheeks, purse your lips, blow. Okay, everything look normal and clench your teeth. Good. Everything look normal with any abnormalities. So that means your cranial nerve number 7 is intact. Next, what I gonna do? I gonna check your cranial nerve number 5. So clench your teeth, please. Yes. And I'm gonna try to move your mandibular. Okay, it's normal. Do you have any pain? No?
No.
So what I'm gonna do, I'm gonna check your trigeminal nerve number 5. I'm gonna just touch you on the face in different spots. You're gonna say for me it's sharp or dull. Okay, so this is gonna be sharp and that is gonna be dull. Okay, close your eyes for me.
Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay, the patient cranial nerve number 5 is intact. Next, I'm gonna check cranial nerve number 1. It's olfactory. So I'm gonna give you something to smell. You're gonna cover one nostril at a time, and later on you're gonna say what it is. Close your eyes, please.
Green tea. Green tea.
Okay. So cranial nerve number 7 are intact. Next, I'm gonna check cranial nerve number 9 and 10. Okay. Open your mouth, please. Say ah for me. Okay. So your tongue look normal with any lesions. It's everything. It's glycerin. Or look pink. Her mucosa buccal look pink, nice. Her tonsils not enlarged. No exudation. Her gums. Can you show me your gums, please? Yes. No redness, no inflammation. Her teeth are not losing. She has all teeth. So everything look normal. Cranial nerve number 9 and 10 are intact. Next, I'm gonna check for your cranial nerve number 12 is hypoglossal. So one more time, stick your tongue out. Yeah, as I noticed before, her tongue is in midline. Glycerin pink. I didn't see any abnormalities, any lesions, any crackles. And also say for me, please, 3 words: tide, light, dynamite.
Highlight dynamite.
Okay, your cranial nerve number 12 are intact and the patient articulates good. Next, what I'm gonna check for cranial nerve number 11. So please move your head in my resistance. Okay. And your shoulders, I'm gonna push down, you push up. Good. So strange 5 out of 5 cranial nerve 11 are intact. Next, I'm gonna palpate your lymph nodes. I'm gonna start with pre-auricular first, post-auricular, cervical, occipital, submandibular, and subclavicular. Okay, lymph nodes are not enlarged, no tenderness. Notice if they're gonna be enlarged or tenderness, it's gonna mean some malignancy. Next, I'm gonna check for patient color of the skin. Her color of the skin are appropriate for her ethnicity. If I'm gonna see any abnormal color on the skin, such as pallor, this can mean like white, can show us like patient has some anemia. If I'm gonna see erythema, it can mean some redness. If I can see jaundice, it's yellowish of the skin, so patient can some problem with liver, and also any like cyanosis, like bluish of the skin, so that can mean patient doesn't have enough of oxygen. Next, what I'm gonna check for skin temperature, I'm gonna remove my gloves and some hand hygiene. So I'm gonna check with my dorsal. You have to like this for me. Her skin are moist, not moist, it's dry, no diaphoresis, warm to touch. I don't feel any coolness or heat. I'm gonna check for skin turgor. Skin turgor are normal. If it's gonna be stay longer than it's supposed to be, so it can mean the patient has some dehydration. Next, I'm gonna check for capillary refill. The capillary refill I'm gonna check on every fingers and toes. It's supposed to be less than 3 seconds. So this means her oxygenation, blood flow is normal. Okay, everything look normal. I'm gonna check for your carotid pulses, one at a time, to prevent any occlusion. Okay. And I'm gonna auscultate for any bruit sound which is abnormal. One at a time, take breath and hold on. Okay, relax. One more time. Good. Your carotid pulses are normal bilateral. I don't hear any bruit. Next, I'm gonna check for your pulses. So, brachial, bilaterally, and radial. Upper pulses are normal. They're 2 plus bilateral. Now I'm gonna check your lower pulses. Lie down for me. So I'm gonna check for popliteal, then for tibial here, and for pedal. They're bilateral equal +2. Next, I'm gonna check for patient and like inspect the chest. If I see like barrel chest, that can mean patient has COPD or CHF. I'm gonna notice like patient sitting in tripod positions. It can mean patient has respiratory distress, and also if a patient like in 90 degrees pursed lips, it can mean patient has a cardiovascular disease. So I don't see any abnormalities. The patient is breathing equally. The normal rate is supposed to be from 12 to 20, and to check that, I'm gonna pretend that I'm like checking her pulse, and when I doing it, I'm gonna count and see how she's breathing. So her rate was 15. So it's normal. I'm gonna check for your lung sounds, anterior, posterior, and lateral. And also, I'm gonna look on your landmarks. So substernal notch, midsternal line, intercostal space, ribs, and intercostal costal angle, and clavicle here. Okay. So 8 space. Gonna listen for your last. Take a deep breath every time when I move. On 1, 2, 3, 4, 5, 6, 7, 8. Okay, now please turn that side for me. Take a deep breath every time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. You like this for me? Yes. 1, 2, 3, 4, 5, 6, and 7. Okay. Next, we're gonna check your apical pulse for 1 full minute to see if there are S1 and S2 present. And I'm gonna listen for 1 minute. So the S1 and S2 was noted. Next, I'm gonna listen for your heart sounds. Okay, aortic. It's gonna be on her right, second intercostal space. Pulmonic on her left, second intercostal space. Herbs on her third left intercostal space. Tricuspid on her first left intercostal space, and mitral on her fifth left intercostal space, and mandibular line. Okay, everything look normal. I'm gonna check your abdomen. Please lay down for me. So we're gonna inspect first. I don't see any abnormalities in the skin. Everything look normal. Her umbilical is on a midline. I don't see any pigmentation of the skin too. Next, I'm gonna listen her bubble sounds. Supposed to be between 5 to 15. If it's less than 5, hypoactive. If it's more than 15, it's hyperactive. I'm gonna listen with my bell. I didn't hear any gurgling, any abnormal sounds. The abnormal sounds can be vascular sounds. So the vascular sounds, can be heard on aortic. If I'm gonna hear any bruit, it can mean aortic aneurysm, and also like venous hump. This can mean like pulmonary hypertension. I'm gonna listen for renal, iliac, and little lower for femoral. Everything look normal. All sounds are normal. Next I'm gonna palpate. So first I'm gonna do light palpation, 1 to 2 centimeters in a circular motion, cover 4 regions of the abdomen. Next I'm gonna do a deep palpation, 4 to 6 centimeters, to check for any abnormal masses and also the sizes of organs. If you feel any discomfort or pain, let me know. Okay, everything look normal. Okay, next I'm gonna check for her skeletal and extremities. So for that, please stand for me. I'm gonna look for her curvature of the spine. Look normal. The shoulders, everything's supposed to be symmetrical. Have a seat for me. Remember, feeling I asked you to memorize 3 words. Can you repeat for me?
Sky, apple, candle.
Good. So cognition and memory are intact. Next, I'm gonna check for range of motions. So do for me, please, like this. Up, down. Okay. Now stretches with resistance. So 5 out of 5. I didn't see any limitation or injuries. Next, I'm gonna do the same with your legs. Yes, with resistance. Okay, the range 5 out of 5. Also lay down for me. And do with 1 foot. Up, down, legs, side. The same with another one. Up, down, legs, side. Good. Don't see any limitations or problems. So next I'm gonna check for coordination, finger to nose. Okay, ramps. Yes, as you can. Heel to chin, lie down please. And your heel to chin. Yes. Right. Yeah. Down. And another one. Okay. So coordination are intact. Step please. Down. I'm gonna check for lumbar test. Okay, so close your eyes for me. I'm gonna just stay here in case she's moving. You can open your eyes now. So the lumbar test, testing for any vestibular or cerebrovascular disease. If she's like moving, like light swing, it's okay, but if she's moving more, so that can mean she has a problem. And the lumbar test will be positive. Her lumbar test is negative. Next, I'm gonna check for deep tendon reflexes. So it's the last one. What we're gonna do today? So we're gonna check for tricuspid first. Next, I'm gonna check for also here for triceps. Next, we're gonna check for biceps, brachioradialis. Okay. Next, I'm gonna check for patellar. Okay. Next, Achilles. Okay. Okay. Deep tendons, reflex 2 plus, and they're bilateral. Next, I'm gonna check for Babinski, which is will be abnormal for adults but normal for the babies. So what I'm gonna do just like this, and if her toes go up, this means she has a positive Babinski. And the same I'm gonna do here. So she doesn't. Next, what I'm gonna do, if everything is like all deep tendons are hyperactive, I'm gonna check for ankle clonus. I just gonna hold the ankle, and if the patient moving like this foot, it can mean the positive. And the same I'm gonna do with another one. So she's fine. Everything look normal today. So, okay, do you have any questions?
No.
No? Okay, then see you next time.
Thank you.
Thank you.